Hi everyone, my name is Kendra, and for this discussion, we will be talking about gout. Gout is an inflammatory disease caused by an overproduction or an decreased excretion of uric acid. Uric acid is a byproduct of purine. Uric acid crystals form in or migrate to areas that are cool in the body. These areas are generally found in the joints of the fingers, the toes, the knees, and the elbows. These deposits increases the risk for inflammation, or the inflammation process goes to these areas. Therefore, that's why patients who have gout experience swelling, tenderness, pain, and redness to these joints. Gout flare-ups can be chronic or acute. They generally last from 3 days to 2 weeks. Treatment should always be initiated within the first 24 hours that the first attack happens. Non-pharmacological treatment includes ice and elevation of the joint, resting the joint, diet changes, and exercise. Sometimes limiting the amount of purines that we take in our diet can help prevent so much production of uric acid. Pharma- pharmaco- Pharmacological medications include NSAIDs or anti-inflammatories, corticosteroids, anti-gout medication, and uric acid inhibitor medications. The first medicines that we will be talking about is colchicine. Colchicine is an anti-gout medication that is generally given to those who have acute gout. This relieves the attacks and generally are started within the first 24 hours that the attack happens. Colchicine works by relieving pain when the medication binds to tubulin that prevents the cell function of granulocytes, which are a byproduct of, well, not byproduct, but which is a part of the inflammatory process. And these area migrate to the area of inflammation. Colchicine is usually given orally and is absorbed through the GI tract. It is excreted by feces and urine. The doctors generally start the patients on a low dose, and signs and symptoms include generally those of the GI area, which is a nausea, vomiting, diarrhea, upset stomach. With patients that take colchicine, you want to make sure that you monitor their creatinine clearance, their liver function. So any of those that have liver failures, they wouldn't be a good candidate, and also those who are taking statins. The other medication that we're going to be talking about is allopurinol. This is an hexadine oxide inhibitor, which means that it slows down or prevent the production of uric acid. It works by reducing the last two stages in uric acid production. It's generally given orally. The half-life is between 15 to 18 hours. It is excreted through the urine and feces, and it is also given to patients daily. Generally, the doctor will start them on a low dosage, and the patient, depending on how much in their labs, they can go up to as much as 800 milligrams a day. Things that you want to consider with patients that are taking any kind of gout medications is that you want to make sure that you are monitoring if they have any side effects, whether it's just the smallest. You also want to monitor their liver and kidney function to make sure that they're excreting the medication properly and is not causing damage to other organs. You also want to make sure that these medications, that patients who are immunosuppressant, who are sensitive to the medication, that the doctor talks to them so they'll know for future references. things as nurses and as students that you want to educate your patient is that they need to see their doctor before starting any kind of medication, that they need to have labs monitored regularly, so they need to make sure that they maintain their doctor's appointments. And they also should never stop the medications abruptly without speaking with their physician. Hopefully everyone has a better understanding. Thank you.